Hi, it's Christina with the Sisyphean Journal. Today is July 16th. Yesterday I shared some background on Gideon Kioko. Actually, some foreground because this is after the death of Debra Gray, whose anniversary was yesterday. I'm going to provide the link to today's anniversary that I already did a video on previously. And I'm going to provide a link to part 1 of When Kioko Flies Solo. But you need to keep in mind, all of this stuff happened well after the deaths of Debra Gray and Susanne Logan, and I'll link to them below too. We're looking at a medical board document, which I will link to. Going to start on page 16, looking at his treatment of patient A. And remember, this is after one patient died. The other patient was fatally injured. I know he lost the lawsuit, but he lost the lawsuit right before she died, and I don't know if he cared enough to find out that she died. So, patient A. On December 1st, 2004, patient A, a 26-year-old female, presented to respondent's office at 9 a.m. for a termination of pregnancy procedure. Other than respondent, no one else was present in the office. I would not want to be alone with an abortionist. You can look at some real doozies. Like, I'm going to make a note. I need to also include Ac Polonu about why you don't want to be alone with an abortionist. So that's Ac Polonu. Okay. Respondent telephoned someone to come to the office, so at least he wasn't doing the procedure with her spread-eagled and vulnerable. Patient A informed respondent that she believed she was about 4 months pregnant. Respondent performed a sonogram and informed patient A that she looked more than 4 months pregnant. Patient asked if there would be any problems, and respondent stated there would not be. I notice he's not being specific about how much more than 4 months she is. Initially, during the investigation, respondent reported to the board that he did not obtain a sonogram on patient A because the electrical power had gone out. Why are you operating the clinic with no electricity? You can't run your suction machine with no electricity. What the hell's wrong with you? Later during the investigation, respondent stated that patient A was about 19 to 20 weeks gestation. Well, 20 divided by 4 is 5, so she was about 5 months. Based on a sonogram that respondent performed in his office. Patient A's medical record in respondent's office did not contain a sonogram or documentation of fetal measurements. Respondent then stated that sometimes a sonogram does not print if it is out of paper, but respondent did not recall if that occurred in this case. Well, obviously, he did not print a result, and by the time the inspectors came to the clinic, it wasn't printing at all. An unidentified young female presented and took patient A's vital signs. Respondent did not perform any blood work on patient A, including RH factor and hematocrit. Failing to check for RH factor and administer ROGAM can threaten future unborn babies, so she could lose a wanted pregnancy because of this shortcoming. According to patient A, at approximately 10 a.m., respondent started an IV and gave patient A Motrin. During the aspiration procedure, office electricity was going on and off. Why? I guess he wanted the money. Respondent stated that he began the procedure at about 11:30 a.m. The exact time should be documented in her records, but I guess he couldn't bother. I mean, come on, I'm a supports coordinator. I just meet with people. You know, I do what's called monitorings, where I go to their house or I meet them at their day program or someplace in the community to see how things are going. And what time I got there and what time I left. I don't, well, I got there at around 2. You know, if you look at my records, it'll say I got there at 1:57 or I got there at 2:05. If I can do that for something where it really doesn't matter that much what time, other than for billing, I'm accurate for billing purposes. This guy, this is medical information, and he's like, yeah, well, eyeball it. During that procedure, while he was aspirating, there was a power failure for about an hour. Again, why? He knew the electricity was wonky, and he knew he needed his machine, and I'm hoping he had lights. What was he using, a flashlight? Oh, my God. Patient A reported that around noon she started to feel dizzy and hot and asked for her cell phone to call her emergency contact, but respondent refused to give it to her. Patient A stated she begged respondent to call her contact, but respondent would not do so. Respondent then resumed the procedure at approximately 2 p.m. Respondent stated he was able to remove the placenta, but was unable to remove the head, which the head's hard to grab hold of. You know, it's round, it's slippery. You know, imagine trying to pick up a slippery plum in water with a pair of these forceps. It'd be really hard to grab it. Respondent reported that patient A started to bleed profusely. According to patient A, respondent informed patient A that he would have to cut the baby up to get it out, but was unable to get the head out. That's a little callous. I mean, if you want to tell her that the baby's getting dismembered, the time to do that is before you start the abortion, so she can decide if that's what she wants happening. If she might not want her baby cut into chunks. And I know that sounds like, how does she think the baby's going to come out? But when you're in a stress situation, you're not thinking clearly. Respondent stated that patient A's bleeding continued. Patient A reported that she told respondent to call 911 because she could not breathe and kept passing out. Patient A reported that her blood pressure was not taken after the initial reading. Again, this is after he had Susanne and Debra tank. One of them he knew fatally. The other one he knew she was left severely disabled. Respondent stated that he called his wife, who came to the office from her place of employment, to assist. Call your wife to help when your patient's in life-threatening danger. Respondent's wife took vital signs, including blood pressure, and observed patient A. At 3:50 p.m., respondent called 911, stating that a female is having an abortion, is bleeding profusely, semi-conscious breathing, unknown if blood thinning disorder. So they didn't bother checking any of this. Respondent stated to board staff that he requested that patient A be transported to Prince George's Hospital. Prince George's County Fire Department ambulance arrived at the respondent's office at 3:55. So it only took them 5 minutes to get there to provide this help. According to the Maryland Ambulance Information System report, upon arrival, emergency personnel heard a woman screaming from the back of the office. Respondent met the personnel and stated that the patient was bleeding heavily and that the baby's head was still inside. Well, at least he's being honest and giving them accurate information. A lot of these guys don't. Respondent stated that the heavy bleeding had begun over an hour previous and that patient A may have DIC, disseminated intravascular coagulation. That means her blood clotting factors are completely out of whack and she can bleed out pretty quickly. Emergency personnel entered the room where patient A was located. The ambulance report noted, female patient naked from the waist down and rolling back and forth on the table screaming. Patient covered in blood, legs bathed in blood, heavy consistent stream of blood pouring from patient's vagina. Table covered in blood, numerous equipment tools on the tables covered in blood. Suction unit on table also covered in blood and had blood in it. Patient had an IV line started by on-scene office personnel. IV bag also covered in blood. Patient responded to her name but could not answer questions, moaning and screaming. Patient stopped moving. Female attendant on scene tried to arouse patient, no response. Emergency personnel slid onto cot. I'm not sure what that means. Patient awake is being moved and responded by screaming again. Emergency personnel transported patient A to Washington Adventist Hospital, the closest emergency department. Not the one he wanted. I don't know why. Sometimes they'll want the patient taken to a hospital where they know somebody's going to cover up for them. Patient A arrived at Adventist at 4:09 p.m. On arrival, her hematocrit was 12.5, hemoglobin 4.2. She was in shock and likely in DIC. Patient underwent surgery laparotomy by the on-call GYN. The surgical findings were uterine perforation, cervical laceration, vaginal laceration, retained fetal skull, and vertebral column. Procedures performed were exploratory laparotomy, repair of uterine perforation, repair of bilateral uterine artery laceration. So no wonder she's just pouring out blood like a spigot. He slashed her artery, bilateral, which means on both sides. repair of 2 cervical lacerations, repair of vaginal vault laceration, transfusions, and estimated blood loss of 400 cc. Patient was taken to the emergency room in guarded condition. Final pathology of uterine contents included a fetal head of 17.5 centimeters and upper vertebral column, placing the gestation between 20.5 and 22 weeks, so she was even further along than he thought. Patient A was discharged home on December 6, 2004 in stable condition. So, this guy, what a piece of work. I mean, I've seen worse, but I don't think you'd trust this guy with a house plant. Come back later for more on him, because they've got patient B